The National Institute for Communicable Diseases is warning that the country could record more cases of the monkeypox virus in the coming days. They are urging government to roll out a plan to contain it after the country recorded its first case last week. Now, Health Minister Dr. Phaahla confirmed that a 30-year-old Gauteng man tested positive. For more on this, we are joined by Dr. Kapil, a public health activist. A very good morning to you, Doc, and thank you so much for joining us. So, of course, as I've just said, that we're expecting, more cases of the monkeypox, but how bad can we anticipate the situation to really be?
Good morning to you and your viewers out there. Thanks for having me. So right now, although one case has been detected, this is simply the only case that has been identified thus far. We must remember that in any public health response or in any outbreak or epidemic, that there's many other cases that are still out there undetected, and the whole state of the pandemic, so the whole state of the outbreak thus far with actual total or actual cases is yet to be determined. Right now, I think focus should be on testing and a robust community and public health response to ensure there's increased awareness about the symptoms of this. The actual numbers are still to be determined, and even global estimates right now, which are over 4,000, are yet to be lower than actual figures due to underreporting and undertesting.
Doc, South Africans come out of a 2-year pandemic, lockdowns, loss of income, death, we are traumatized as a country, we're traumatized as a world. So this now happening just as the restrictions were eased by the health minister essentially sends us back, into a period where we do not want to be finding ourselves in, a period of fear. Do we have anything to be really worried about? Or is this just a matter of, better safe than sorry?
So the world has been traumatized and in a state of fear and hysteria due to COVID-19, and understandably so. The toll that it's taken on our lives, we've lost family, friends, colleagues, everyone has been strained physically and mentally. And now hearing about a new outbreak of something that seems to be quite foreign to everyone, although monkeypox has been around since the 1970s, it does send alarm bells ringing. Right now, there's no need to panic. The symptoms are less severe than smallpox, which many people have been associating it with, and it is not as infectious. However, we still need to exercise caution. We need to adhere to basic public health measures. Simple tasks such as washing hands, sanitizing, social distancing is still quite key. There's been a lot of debate about whether, now that South Africa has eased down lockdown regulations, whether this should be repealed and whether we should now begin instituting these lockdown measures in light of the monkeypox virus. And this remains another debate. But I think we should rather be safer than sorry in this instance, because right now it may be one case, but cases in actuality are far higher.
All right, Doc, unfortunately, we don't have any more time, but we do leave it to thank you very much for just, helping us understand in context what it is exactly we are dealing with. And I suppose, from someone who is a public health activist, it is quite encouraging that we have not really much reason to panic. But it is important, South Africans, of course, that we practice those, necessary safety measures, because this is still something that is a risk to our health. And of course, as I've mentioned, we are not necessarily coming out of a pandemic, but, we've found a way to proper deal with COVID-19. So we wouldn't want to now find ourselves slipping back into something else that is going to cause a whole lot more distress in our world. But yeah.